I'm Tseng. I am the Associate Dean for Diversity, Inclusion, Equity, and Climate at the Cummings School of Veterinary Medicine at Tufts University, which is like a really long title. In any case, this half hour I'm scheduled to talk to you about wildlife medicine and the program that we have here at the Cummings School. So this is just a picture. This is the outside of the wildlife clinic building. The clinic is on the right-hand side as you're facing the building like this. And then there are offices and conference rooms and things like that on the other side. But, you know, this is kind of the boring part. So, so here's a little bit about me. I was born and raised in the DC area, and I went to undergrad at Oberlin College in Ohio. I received my Doctor of Veterinary Medicine at Cornell Vet School. And I was in private practice for 9 years in upstate New York. I actually saw wildlife and exotic species in private practice. Then I completed an internship at a private wildlife rehabilitation center, which is a very large one in the Shenandoah Valley. And then I was lucky enough to be able to work as the staff veterinarian at two large wildlife centers on the West Coast. The first was the Progressive Animal Welfare Society Wildlife Center, and that's just north of Seattle, Washington. The other one was International Bird Rescue, which is in the San Francisco Bay Area. Eventually, I moved down to the San Francisco Bay Area in order to do oil spill response, which is what, you know, I did for a number of years. So that means, you know, traveling to the places where there are oil spills and taking care of the wild animals there. But I have been here at the Cummings School since 2000, so a long time. So, okay. So our wildlife clinic has the same sort of goals as you would have for any other teaching service. So certainly education of our veterinary students. We do some clinical research. Dr. Mark Pokers, who's one of our former directors, this is an X-ray of a loon, and there's a metal object right there in the stomach area, and he found that over 50% of the freshwater loons that died in freshwater in New England died from lead poisoning, and that's what this is. It's a lead fishing gear. And then, you know, service in taking care of the animals that are brought to us, mostly by the general public. Okay, so all of our students are required to do a rotation through the wildlife clinic. So this is one of our former grads. She's actually a veterinarian now at the Smithsonian Wildlife Conservation Center. And here we are, we're looking at a loon. We're about to do some endoscopy to try to get out probably fishing gear. This is one of our former interns. She's a veterinarian at the Bronx Zoo, and we're looking at a snapping turtle that got some of its shells sheared off. And here, these are old-fashioned x-rays. Right now, we just use digital x-rays. We've done that for many years, but here are some students just looking at x-rays. Those are squirrel x-rays, as a matter of fact. So in a lot of ways, our wildlife clinic is just like a small animal clinic, right? So we have a surgery area and we have radiology, but then because we are working with wildlife, definitely there's a lot of other things going on. This top picture is our main ward, and this is where the animals will come when they're stabilized. And there's a variety of different kind of caging, but all of our caging is designed such that the animals cannot see us because it helps to reduce their stress. This is a picture just of some of our outdoor, smaller outdoor pens. We use them as small aviaries, or, you know, for some of the mammals too, they'll come out here. And then we are lucky enough to have two of these flight cages. These are 100-foot long, 40-foot wide, 40-foot tall, and they're actually there in order to be able to rehabilitate, exercise some of the larger birds, usually the birds of prey that we get prior to their release. Okay, and there is a little possum. I don't know if you can see that well, but there's a little possum that is in one of our smaller aviaries. And the pictures on the right are inside of the flight cages. So you can see in this bottom picture, there's two red-tailed hawks that are exercising themselves in there. Some species like red-tailed hawks, which are very kind of amenable species to have in captivity. You know, we can put more than one in these cages to exercise, which is good because we need the space. But, you know, there are some species that are very fierce, like great horned owls, that we would never go ahead and put two in. So, okay. And then we also have a seabird pool room. So this is a northern gannet on the top left in the pool. And most of the seabirds that we get in from the coast are such that they really do much better in water, right, rather than on solid surfaces. So that's why we have that pool. On the top right, we do have a pool room also with a slope floor that actually we can fill with water. And then we can put waterfowl like the Canada goose up top there and the mallard ducks on the bottom right. And then sometimes we get in animals like this red-breasted merganser duck type bird on the bottom left. And again, this is one of these species that it can stand okay on land, but it really should be in the water. And so we put it on this net bottom caging in order to let the feces and everything fall through so it doesn't contaminate their feathers. And this also prevents pressure sores from, you know, if you were putting them on a solid surface. Okay, so lots of different kinds of caging and obviously lots of different kinds of patient nutrition. This is a juvenile red-tailed hawk on the top, on the left-hand side, and he's eating a lab mouse. So we are very lucky to be able to get culled lab mice from some of the pharma labs around here. On the top right, there is a Canada goose, and it is looking in a mirror. And the reason for that is because these are social species, right? You usually see them in flocks. And so if you put a mirror in, they do think that there's another goose in there, which makes them feel better. And then on the bottom right, you can see that's a snapping turtle that's had shell repaired and is eating fish. They eat whole prey, so we can give them mice and fish and things like that. Okay, so why do animals come here? Lots of orphans, maybe orphans. They're oftentimes kidnapped and not really orphans. People are well-meaning, but, you know, bring us baby animals that don't necessarily need to come to us. On the top left, those are about a week-old baby squirrels. So squirrels build really awful, like not very tidy nests, and when there's a big wind, that nest will get knocked down, and so the babies will fall down and people find them. And, you know, if you find baby squirrels like this and they're uninjured, you should just make a nest out of something like a plastic tub and put some holes for drainage in it and line it with paper towels or grass, and then try to wire it back up in the tree. And usually the moms will come and fetch them and put them back up into hopefully a better nest. But, you know, again, these get brought to us sometimes when they really don't need to be. So on the bottom left, those are obviously baby Eastern cottontail rabbits. And these often get kidnapped because the moms make these really terrible grass nests, and they're on flat surfaces, and they could be in the middle of your lawn. And the moms leave them alone during the day. They actually hide out in a bush and watch the nest, but they're not right with the baby rabbits because that would attract predators, right? So people do find these and don't see the mom, and so they kidnap them, and that's not great because cottontail rabbits do not do well in captivity. On the top right there, those are baby possums. And these are actually my favorite babies that come in, baby mammals that come in to the wildlife clinic because they can be really small, but they're, you know, they think they're really big and they hiss at you and they're really quite adorable. And on the bottom right there, those are turtle eggs. So we do get a lot of turtles that come in. And, you know, many of the females early in the season still have eggs. If we have to put them to sleep or if they die, then we're going to take those eggs out and we incubate them. And usually about August, all of those start to hatch out. Okay, so other kinds of orphans, top left there, some sort of baby sparrow or finch. Bottom left, those are kind of like preteen robins. And, you know, they have these bright yellow mouths because, and most species do, songbirds, because that's tells the parent, this is where you should feed me, right? In the middle on the top, that is a young red-tailed hawk, and on the bottom, that is an adorable young barred owl. Top right, those are mallard ducklings, and so we often get them in very large groups. And on the bottom right is what I call in the so ugly it's cute category, and that's a baby pigeon in there too, which people will also bring us. Okay, and so with a lot of the species, we do have to be careful not to imprint them on humans. So here we are, we're feeding a baby screech owl some chopped up mice, and we do have face masks and the ability to screen ourselves from them when we're feeding them too. Okay, so in addition to the babies, certainly we see animals that are have all kinds of trauma. One is being hit by a vehicle, any kind of vehicle. It's, you know, usually a car, but it could be, I don't know, a truck or a train or anything you can imagine. So the great horned owl on the top left there has uneven pupil size. You can see that. Usually that is from the fact that they've had some head or eye trauma or both. And on the top right there, I think it's hard for you to see, but that's a hawk, and it has blood in the front chamber of the eye. And on the bottom, that's me on the left-hand side, and I'm just doing an eye exam on a Eastern screech owl. And on the bottom right, that's one of our students, and she is examining an eye on a younger bald eagle. So bald eagles do not get their white on their heads and their tails until they're about 5 years old. And so when they're born, they're chocolate brown. And then as they age, they get, you know, more and more white and less brown. And so this is probably like a first year bald eagle. Okay, and when we're doing eye exams, this is what we're looking at when we get back to the level of the retina. This is an owl, and the reason that I know that is because owls have very little pigment in their retina, and you can actually see blood vessels here that are in the choroidal layer. So that's the layer behind the retina, and you're able to see that. They only have a little bit of pigment, like you can see, you know, kind of down here. Whereas hawks and other, you know, birds of prey or other birds, you know, tend to have more pigment. And so you don't necessarily see this very nice blood vessel picture. This big black thing is called the pecten. P-E-C-T-E-N, and that is there. It's a big sort of vascular structure that birds have. It attaches right over their optic nerve, and it free floats out into the back chamber of the eye and provides nutrition, like vascular nutrition. Okay, and then, you know, again, being hit by a car, you can certainly get animals that have coracoid fractures. And so this x-ray, here's the neck on the peregrine falcon. Here is the wing on both sides, right? And then this is their clavicle, so like our collarbone, okay? But they also have a deeper and a bigger strut across their bodies, like the clavicle, but it's called the coracoid. So here is one side of it, and here is the other side. And here on the side, you can see that it's fractured, okay? And we do see that a lot when animals hit something like a building or something like that straight on, they can get clavicle and coracoid fractures. And so that's what happened with this peregrine falcon. And basically, we're just going to fix that by bandaging the wing to the body and letting it heal itself, because to go in surgically here is very difficult. You end up removing a lot of muscle. And so the healing is just as good with bandaging them up. Yeah, that illustrates the fractures. Okay, and then turtles, right? So in the spring, summer, we tend to get a lot of turtles. The females are usually out looking for places to nest, and the males are out there looking for females, right? So here is a painted turtle that has a pretty recent fracture. It's not too hard to fix. We just put wires across when they're under anesthesia, of course. And then this yellowish stuff is actually a slow release antibiotic that we put in, and it kind of acts as a glue too. This snapping turtle is not so lucky. So snapping turtles are big, you've probably seen them, and they're very slow. So when they cross roads, you know, they're likely to get hit. And when they see a car coming at them, their method of appearing really scary is to stand up really tall. But unfortunately, that means they scrape the undercarriage of the vehicle. So that's what's happened with all of these. And, oftentimes we have to get the wounds really clean before we can, do the actual repair there. Here's another painted turtle, but this is, worse in terms of fractures because it goes all the way across. And in turtles, the vertebrae are attached to the underside of this top shell, the carapace. So there's a possibility for spinal trauma. Also, this goes down to the bridge on either side. The bridge is the part that connects the top shell, the carapace, with the bottom shell, which is the plastron. And then also you can see she has eggs, right? This fracture that she has is really going to take a long time to heal. So, because turtles are very slow, right? They do everything in turtle time. So, we're going to give her some hormones. She's going to lay the eggs. And again, we're going to incubate the eggs and raise them ourselves. Okay. Also, animals that come to us with fishing line entangled around, their legs, or fishing hooks that they've swallowed. On the left, there is a snapping turtle. You can see two fish hooks there. And on the right, that's a gull that has a great big giant fish hook, and that is in a really bad place. It's right at the base of the heart, and we can't get to it surgically. So that would be an animal we would have to euthanize. Which means that if any of you fish, hopefully you would always clean up your fishing line and your fish hooks, because all these aquatic creatures definitely can get into that and get in trouble. Here's the fishing hook in the mouth of a snapping turtle. You can see it's kind of an old wound because he's got all of these reaction, infectious areas from the hook, but this is pretty easy to get out. At least it's, in the mouth. This one, it looks really gruesome. This is through the eye of a painted turtle. Again, it's easy to get out. And we're going to treat this as an open wound, and then hopefully they'll heal up and we'll be able to release them. But they oftentimes do okay with just one eye. Okay, less common, but very cool patients. So we do get carnivores in. We have a whole carnivore ward. On the left, I'm looking at looks like probably a small yearling black bear. And this one had a fracture in the left front leg there that you can see. Just has a bandage on it right now. We're going into surgery. And on the right-hand side, that's a bobcat. And his whole hip area is shaved because he had a fractured hip. And, the nice thing about being at the vet school is we have all sorts of experts, right? So, we had just one of the orthopedic surgeons come and just fix the hip like he would for a dog or a cat. It's a metal plate. And so that one healed up fine and was released. So just to give you an example of some of the kind of really cool things that we can see, because we are, seeing all sorts of wildlife. And we see probably about 4,000 animals a year. Maybe 65% of those are birds, 35% are mammals, mostly common, rabbits, etc. And then the difference being, reptiles / amphibians, the occasional invertebrate, but lots of birds. But this is the only bald or golden eagle that we've had in the 23 years that I've been here. So this is an endangered population on the East Coast. It's very rare. They're much more common on the West Coast. And this was an eagle that was found grounded, not flying, near the New York-Connecticut border. And it was very thin and weak. It hadn't been able to hunt, to feed itself, because it had bite wounds that were infected on the left foot. And so, it wasn't catching prey very well. But it was fairly easy to heal. We just, took it in, treated it with cleaning the wounds with antibiotics. We splinted the foot. And after about a month, this bird was ready to go. We do get a fair number of bald eagles in, but I would much rather have golden eagles because they're just so much nicer to deal with than bald eagles. Bald eagles are really fussy. So, okay, so after about a month, it was released, and we were working with some of the wildlife biologists that were studying this endangered eastern population. So this bird was fitted with a satellite transmitter, and then you can see from this map This is where it was found and was released, and it hung around there for a couple of weeks. And then this is breeding season, right? It's March, late March. So then after that, he or she just headed straight up to where they nest and breed, which is way up in the Arctic Circle. And then in the fall, came right back. It's amazing, right back to where it was found. And, bird migration is just amazing that they can find their way back to, those exact areas. But the really cool thing was that the biologists were using their data about flight paths of golden eagles in order to help wind energy companies, because golden eagles like to fly on high ridges where there is a lot of wind. And that's where they like to put wind turbines too. Excuse me. So they were trying to not put their wind turbines where the golden eagles were migrating, because, it's a federal offense if you kill one. Okay, but tricks of the trade. These are great horned owl feet who are very, very strong. If you get one into you, you'll pretty much have to sedate them or anesthetize them to get those out of you, because the pounds per square inch is crazy. Hands away from the mouth, right? So snapping turtle, we're only on this end because this turtle is asleep, right, and anesthetized. So they have very long, snaky necks, and they reach out and, bite off your finger if they wanted to. Bobcat. So, we're not getting anywhere near this bobcat until it's sedated. And so we have different methods of getting it sleepy, and then we will do our diagnostics and treatments and things like that. And this is a little green heron, which reminds me to tell you, don't underestimate the little ones, because this heron, like all herons, have very long, snaky necks, and they are used to stabbing for food in the water. And they will stab at your shiny eyes, in defense. So that is unfortunate and not something that you want to do. Okay. And that might be the last one. No, not right. Okay. So really what we're doing is we're trying to get these animals out for release. And right now in this picture, we're just putting on a U.S. Fish and Wildlife Service band on the leg of this red-tailed hawk. You can see the band going on. And there it is. So that's a unique identifier. And so here's one of our students, and she's about to release the red-tailed hawk. And this is the field behind our clinic, so it's an ideal place for hawk releases. Red-tails are kind of funny because I love them, but I don't think they're the brightest. And so a lot of times we just set them on the ground. We don't do the dramatic thing about flinging them into the air, because I think sometimes that's a recipe for disaster. But, a lot of times they'll just stand there and look around, and it takes them a little bit to realize, oh, there are no walls around me, and now I can fly off. But that's what they do. And so again, putting them back into healthy ecosystems. And so here's the snapping turtle on the bottom left that is going back into a pond. On the top left, on this very, very tiny picture, there's a bobcat that's released down there. And here's a little possum that's going back into the underbrush. So this is Percy, our resident screech owl, who sadly passed away last September. He was with us for almost 20 years.